what strategies is Ethiopia using to support cancer care for women under UHC?
Thank you, Dr. Nicole. So first, it's a pleasure for me to join this panel discussion, especially focusing on one of the most important topics for women's health, which is cancer care. So thank you for inviting me. So as we all know, and in the WHO report, we can see that cancer is a leading cause of deaths worldwide, accounting for nearly about 10 million deaths in 2020, and this accounts for 1 in 6 deaths. So we can see how significant it is because, especially for a country like Africa and a continent like Africa and a country like us, the percent share will increase, but the challenge of addressing it is also high. So in Ethiopia, the most common cause of cancer among adults include breast cancer and cervical cancer, and about 2/3 of deaths due to cancer occur among women, and so this is a tragic number. And the main reason for high cancer mortality include low awareness of cancer signs and symptoms among the community, inadequate screening and early detection services, as well as inadequate diagnostic and treatment facilities. So between 30 and 40% of cancers can be prevented by avoiding the risk factors and implementing existing evidence-based prevention strategies. So in our country, we have developed the first national cancer control plan, which was implemented from 2015 to 2020. And the major achievement we got through the implementation period was increasing cancer screening and treatment service providing health facilities, and enhancement of the human resource on cancer program. Cancer treatment facilities have been expanded to 6 centers throughout the country, in the government, in the public sector, and this has helped us to increase our coverage of service to reach about 15% compared to the baseline of 10%, which was in 2015. Currently, a total of 1,041 health facilities are providing cervical cancer screening and treatment service, and a total of 17 hospitals are providing breast cancer treatment service, and now our 4 hospitals, the largest hospitals, are able to provide cancer radiotherapy service. This was a huge milestone for us. And in an effort to the prevention, we have approved the anti-tobacco law and introduced a mixed excise system on cigarettes, which is a big step to address one of the leading risk factors. And initiation of the HPV vaccine for girls above 14 age was also another milestone in decreasing or in preventing the risk factor for cancer. And recently, Combat Cervical Cancer Initiative was launched and resulted in increased annual screening uptake by 3-fold. So, the other aspect of, in order to develop the human resource, 6 higher institutions are providing oncology service, and there are around 13 oncologists in 2020 compared with only 3 in 2015. So we are increasing our human resource through providing trainings. And the number of pediatric oncologists has also grown from 0 to 7 within the same period. And regarding the public-private partnership, I can say we are in the infant stage, but we have started to develop the framework of public-private partnership, especially in cancer care. One of our largest hospitals in Ethiopia is St. Paul Hospital, Millennium Medical College, and now we are in the completion of the infrastructure-wise, we are in the completion of the cancer center. So we are developing the public-private partnership framework for the oncology service. And even in the care, we usually partner with the private. There are some private facilities which are giving oncology service, so we are doing, we are having a technical collaboration with them, but the especially the financial aspect of the public-private partnership is yet to come in. We are working toward that. Thank you.
Dr. J.P. Bohr-Malenya, early detection is key to win the battle against cancer, but with detection comes the need to treat. How do we deal with the ethical concerns around aggressive screening without the assurance of treatment for the cases that we do find? And how do we make sure that they're able to access quality, affordable cancer care?
I hope you can hear me, and I am very honored to be here today representing the head of the National Cancer Control Program, Dr. Mary Nyangasi, and to just discuss about the issues around early detection and linkage to care. And I must say that this is a very pertinent topic and an important discussion that we must have. And I'll begin by just outlining the policy environment that we have in order to set the stage for early diagnosis of women's cancers. So we have the global frameworks which Kenya is aligned to, and these include the Global Strategy for Elimination of Cervical Cancer, following the Global Call to Action for Elimination of Cervical Cancer by the WHO Director General in 2018. This policy framework gave us the 90-70-90 targets for elimination of cervical cancer, beginning with HPV vaccination for the young girls, 70% of our women to be screened for cervical cancer using a high precision test, and 90% of the women that we screen positive being linked to care. So also, in addition to that, we have the Global Breast Cancer Initiative, which was launched last year, and as a country, we are also aligning to that. So I will just at this point highlight that women's cancers, breast and cervical cancer, are the leading cancers among women in Kenya, and they account for about 23% of deaths of Kenyan women. So in terms of in our country here in Kenya, the policy framework that we have the Kenya Cancer Policy, which runs from 2019 to 2030, and that guides us and guides our interventions, and we implement it through 5-year strategies, which we are currently implementing the National Cancer Control Strategy 2017 to 2022, which has 5 pillars along the entire continuum of cancer care, from prevention all the way to treatment and palliative care and survivorship, and also looking at issues of coordination and effective partnerships. So this strategy gave birth to the screening guidelines and also the National Cancer Specimen Handling Guidelines, which will improve diagnosis, and also along with that, the National Cancer Treatment Protocols to guide and standardize treatment in the country. We also have the National Cancer Palliative Care Policy, which is to guide us so that we can have the resources aligned to the programs that we are envisioning and implementing. So just to highlight that the screening guidelines include breast cancer and cervical cancer as the population, as cancers that should be screened for at the population level. The screening guidelines recommend screening for a target population of 25 to 49 years for women, and recommend HPV test as the gold standard test. The breast cancer screening guidelines recommend mammography as really the primary test for breast cancer screening, but also incorporates what is more feasible here, and that is the clinical breast exam, and also other modalities that are outlined in detail in the guideline. So on to the question on the ethical considerations around aggressive screening versus linkage to care. And I would say that we have aligned ourselves to the recommendations by WHO on screening programs. First of all, the burden of the disease has to be high enough to justify screening, and we have seen that the burden of these women's cancers are quite high. And the other thing is this, the screening should be done when the effectiveness has been demonstrated for that screening, and there are available resources for the target group, and as well as facilities to link to diagnosis and treatment. So what have we done as a country? And of course with the leadership of the Ministry of Health, coming along with partners and other stakeholders. And one of the things that we have done to ensure that we are aligned to the principles of for screening and linkage to care and diagnosis and treatment, we have developed advocacy, an advocacy guide for cervical cancer, as well as materials for information, education, and communication. These ones are across the board for both cervical and breast cancer. We have also developed a training curriculum for community health volunteers. These are the people who are at the front line in the community to create awareness and generate demand for the services. We have also launched the vaccination of the 10 to 14-year-old girls. This was in 2019 and is an ongoing intervention. We have now, in terms of capacity building and training of health workers, in the last 1 year, we trained over 6,000 healthcare workers on cervical cancer screen and treat. And this incorporates breast cancer. Breast cancer screening is integrated into that because really it's the same woman, right? And we have also launched e-learning platforms for health workers, and we have also developed data tools so that we can capture what we are doing, the work that is being done on the ground. Further to this, one of the things that we do when we are implementing is beginning with a pilot so that we align our implementation strategies to the guideline. And so we did a HPV testing pilot in 2019. We also did a mammography screening pilot in the same 2019, and these are informing how we are scaling up screening and early diagnosis of these cancers. In terms of supplies and commodities and data management, we have done a lot. We have distributed treatment devices along with the training, and we have also distributed commodities like speculums, lab reagents, and data tools to the facilities. We have a national cancer reference lab. Of course, it's at national level, and it's the one that supports the HPV testing, cytology, histology. We have also trained and mentored a lot of lab staff and are continuing to do so. Lastly, in terms of treatment, we have 10 chemotherapy centers. These are regional centers across the country, and we recently just launched a radiotherapy center in Mombasa County. This is one of 3 that will be launched. The other 2 will be launched by April of this year. This is in an effort to decentralize treatment. And also, you know, we also have the palliative care policy, which we continue to roll out, and it guides what we do. So that's just to show what we have done so far. Have we really exhausted what needs to be done? No, there are a number of challenges. One, in terms of creating awareness. We need a strategy to guide our communication, and I really would like us to look at this as opportunities for partnership, opportunities for things that we can do together along the cancer, to improve early detection of the women's cancers. We need to improve uptake of screening. We need to improve access to diagnosis and treatment. We need to integrate within the healthcare system routine service provision and, you know, screening to be integrated along that and not just opportunistic screening. We need to continue mentoring and training health workers, continue improving on quality so that we are sure that what we are doing is providing our women with the best that we can. And we need to also improve our supply chain and improve availability of commodities and supplies, and also improve capturing the data. So these are really opportunities where we can all partner, and I think I have said a lot in a very short time, and I wish to stop there. Thank you.
Thank you so much.
Good day, and thank you for the welcome. I'm honored to be here to discuss reducing the cancer threat in sub-Saharan Africa. Thank you for including me as we all begin this work together. As we lay the table to discuss reducing the threat of cancer, we must acknowledge that the time has come to address cancer in sub-Saharan Africa. There are increasing numbers of all cancers and therefore early deaths, and the UN Sustainable Development Goals are addressing challenges which coexist and amplify the cancer impact. Goals number 1, 2, 3, 5, and 10 are addressing these issues. We must face the facts and prepare to take action. To empower women, they need early detection of deadly diseases, including cancers. Opportunistic screening in existing clinics is a beginning, then building a pathway over time to organized screening supported by universal health coverage so all women can participate. This will be a culture shift for women and providers, speaking about what has been whispered: breast, cervices, sex, sexually transmitted infections. In addition, we must consider feasible technologies as a spectrum. In the example of breast cancer, ultrasound versus 3D digital mammography. I was in a town in Uganda where we plugged in an ultrasound unit to the electrical grid and we interrupted power for the entire town. Infrastructure and resources will determine what technologies are used based on this variation. And we must acknowledge that life expectancy changes may take decades. In the US, breast and cervical cancer screening began in the 1980s. Breast cancer mortality has decreased approximately 30%, and cervical cancer deaths have gone from the #1 killer to number 16. It's not a rapid process, yet to begin is critical. As we've considered this topic, we've used our recent data from the Hologic Global Women's Health Index in collaboration with the Gallup World Poll. This data is based on the lived experiences of health and safety of girls and women around the world. The data shows that there are 5 dimensions of health, seen on this slide, explaining 80% of a woman's life expectancy, and preventive care is the most significant and impactful of these 5 dimensions. Testing for blood pressure, cancer, diabetes, and sexually transmitted diseases. And what we understand is that preventive care, including cancer detection, requires awareness, access, and affordability. These are the topics I'll cover: suggestions and potential avenues for increasing awareness by education of women and girls, increasing access by establishing women's health centers, and addressing affordability facilitated by universal health coverage, bridging gaps in cost and human resources with innovations. As we think about awareness, our recent Hologic Global Women's Health Index data shows us there is awareness in sub-Saharan Africa. It is shown here in the graphic that in blue, with a few outliers, women believe in the benefits of care, and yet uptake of care, shown here in purple, is very low. This discussion will focus on the concept of closing gaps between awareness, access, and affordability. We know awareness exists based on our data, yet further engagement and amplification of awareness for women and girls is possible with education. This has been very effective at Hokomela, a trusted PEPFAR site in Hoedspruit, South Africa, leveraging people and resources already at the clinic. Providers and community health workers go to high schools discussing breast cancer, self-breast examination, cervical cancer, safe sex, and transactional sex, speaking about previously unspoken issues. In addition, they've shared experiences of care from support groups of survivors and trusted community healthcare teams. This is the beginning of a shift in understanding and in culture, helping to move toward action. This will also be a transformation for providers, requiring time, training, and experience in communications to amplify awareness toward action. Where action is related to bridging the gaps which exist in resources and human capacity with technologies and innovations, as well as thought innovations. Currently, cervical cancer testing uptake is 13% for women in sub-Saharan Africa. One example of opportunity and bridging is leveraging existing HIV infrastructure in combination with a Hologic Global Access Initiative, currently operating in 13 countries, making testing for HPV and HIV available on the same innovative new platform, which also includes multi-disease testing of additional sexually transmitted diseases, as well as hepatitis B and C. This is now available, and more women are having access, literally having an impact as we speak. As we look at breast cancer, 50% of women diagnosed with breast cancer in sub-Saharan Africa die within 5 years. This is in direct contrast to the United States, where the survival is 98% at 5 years for screen-detected early-stage cancers. There are models demonstrated at Hokomela where local testing for breast and cervical cancer occurs in the community. Partnerships provide transportation, food, and housing for diagnosis and treatment at Helen Joseph Hospital in Johannesburg. As a result of the success, the district hospital in Hoedspruit is setting up local cervical and breast cancer treatment. The ultimate vision is point of care, where we detect, diagnose, and treat in one visit. Innovative technologies such as ultrasound, artificial intelligence support, molecular diagnostics, and cryoablation treatment are capable of adapting to limited resources and skills. We must consider transformation based on successes and begin the journey with the support of universal health coverage. As we look at affordability, we have to consider both healthcare costs and the cost to the woman herself. Regarding healthcare costs, if we use existing resources, community healthcare workers, now COVID testing and vaccination programs, we will be expanding, not recreating care. Bridging gaps in resources and skills, we will lower the cost of the health system, as the example provided of one-visit care for breast cancer. Universal health coverage support is critical and will make this possible for all women. As we look at the burden of treatment for women, step one is more local access with partnerships for the continuum of care. And then the next steps toward the audacious goal of one visit to detect, diagnose, and treat. This model eliminates the cost of travel, decreases the number of visits, diminishes recovery time, additionally and importantly, reduces time away from family and loss of livelihood. Once there's success, we must circle back and close the loop, going back to awareness so that women share the new cancer story and attitudes begin to change, and the ultimate goal is increasing life expectancy over time, and we're one step closer to that. As we summarize, we have to understand that now is the time to address the challenge of women's health and cancer in sub-Saharan Africa, supported by universal health coverage. There are solutions, and step by step, we can add these innovations and care models. Now we need to focus and be disciplined in our collaborations to succeed, and universal health coverage will support the reach to all women. Look at the success of maternal neonatal health programs, community healthcare workers, and the data showing headway in testing for sexually transmitted infections and diseases. We must grow hope that change is possible based on these successes. Integration of preventive care, including screening for cancer, and the developing universal health coverage programs will be critical to decreasing the threat of cancer in sub-Saharan Africa. And why do we do this? Because of the reward. Families, communities, economies. empowering women with early detection of diseases, including cancer, keeping women and girls safe and in school. We will all reap the rewards. Thank you very much for your time today.
Elaborated by the previous speakers, private sector holds innovative technologies and solutions for effective cancer care. How do we ensure these innovations reach all of those who need them?
I believe that this is like a true commitment for all of us, that this is like an important topic and a priority for the continent. And with this, I hope that we will use and leverage on our collective commitment to turn on our partnership to transform and change the narrative around cancer in women in Africa. With this, I will start with telling a little bit more about Roche's commitment, but maybe I will also leverage on what has been already said by Hologic just before me, bringing the data. And I believe that the data are frightening today. And we do have the possibility to change this by working all together. And I'm hearing here also in the panel a lot of initiatives already ongoing on the continent, which is really great. But I believe that we can do even more if we leverage on our commonalities and we adjust the strategies where we have unique challenges. For Roche, we are starting to have like a holistic approach to address all the determinants from awareness until treatment and after treatment, to have like holistic approach centered on women care to have the outcome. And we know that we cannot do this by our own, and that's why we are working hardly to connect with our partners with different perspectives from private and from public to close this care gap. We do have like 3 main goals centered on women's care, and with the 2 main starting point on cancer, breast and cervical. The first goal that we identified as main priority is raising awareness. And we do have like the commitment to have all women in the continent aware of symptoms and risk factors around cancer. The second one is around early diagnosis and screening, and we know that many of the cancer can be preventable and treatable. So this is really important that we work all together on early diagnosis. The third one, last but not least, how can we work also on strengthening the healthcare system so that we can have the support to manage all the patients on the continent. I will start maybe by telling some of the examples where all my colleagues from Roche Africa are working with different partners and with also a lot of communities, starting from awareness. And this is like the biggest challenge that we are facing. And we know here that one size fits all does not work because we do have a lot of differences. And even in the same country, we don't have the same understanding, we don't have the same status. So we are trying to work hand in hand with communities and with women to understand where we stand in each and every region. And from here, we are also trying to build strategy that fits and really answer the needs. And we learned a lot through our journey. And one of the examples, which was really recent, that when we are just educating women and raising awareness only with women, we don't see the impact. We don't see women going for screening. And that's why we are trying to reach out also husbands, partners, families, and parents, and even beyond that, going to adolescents and starting the awareness from this age. So this is one of the things that we are trying to do around awareness. Once we have awareness, it doesn't automatically translate into screening and early diagnosis, unfortunately. And here again, I have a lot of examples coming from different countries. I will take the first example from Mozambique, where we are working with the Ministry of Health and the US government and different NGOs on the ground around a project called SALVA. SALVA is an integrated screening program which is focusing on testing, but also building capacity, awareness, and educating healthcare providers. The aim of this program is to have 20,000 women screened for cervical cancer by end of this year, hopefully. And this will have a huge impact. I know that this is big, but still it's not sufficient because we can screen, but then what happens? We also need treatment, and this is just the first step, but we need to start somewhere. And this is really important for us. So this is regarding screening. One of the key elements that also we are thinking about is how to leverage the digital health solutions to have access to all information for patients. And this is one of the projects that we also are partnering with different private organizations to build an application for patients where we can have access to information, but also that can help patients, remind them about the appointments, having the data, collect the data, and being like, having like everything very close to the patient. We are aiming to launch this application in some of the countries in Africa, and I hope that this will also help in raising and having early diagnosis in the continent. So talking about awareness and then diagnosis, we also know that the foundation would be like having a strong healthcare systems around. And by healthcare system, resilient one, I think that Dr. Rebella this morning also was mentioning the learning from COVID and what it teaches us. And just coming back like in 2019 and remind ourselves where have we been and what was the journey so far. And I see like it was really amazing. We have testing capacity building. We built hospital. We built capability around oxygen and all the things around awareness. We have data in COVID. We have everyone. You can ask everyone in the street and they can teach you about COVID. If we can just do the same for cancer, and I don't believe that COVID has killed as many patients as cancer do, unfortunately. If we can take this learning and take cancer as a priority, we will achieve. And where there is will, there will be always a path. So talking about a strong healthcare system, it means like having the sufficient number of healthcare providers, having decentralized systems where patients can have access close enough to their home so that they can continue their treatment, having standard of care, having guidelines, having policy that supports, having also the funding, and having end-to-end management from screening until the treatment so that we can have a real impact. And maybe I will close with having like the example, and I believe that it was already shared in the video this morning, but I had the experience and I went in the field with the Kenya colleagues here, and it was a real pleasure to see the Empower Clinic in one of the county in Kenya, Makueni County, and it was a huge experience for me and such an impressive experience because from nothing we can do something. And I saw that we have been for 14 months able to screen 1,000 women close enough to their home so that they don't need to come to Nairobi to get treated. And this is really amazing. And this was, we were able to do it through partnering. It was through Roche, but also a lot of investment from the First Ladies community and the county itself. And I think that we can do even more, just with willingness that we will need to translate into actions. Thank you.
So we've heard a lot about the threat of cancer for women in Africa. And I think we need to just go back to remember who are we doing this for. I think Marlon Kibacha in the morning needed to remind us why are we doing this. It is for the women that I see in the clinic, the young ladies with breast cancer, the young ladies with bleeding from cervical cancer or uterine cancer. It is also for the men who are taking care of these women and who may be left with the burden of taking care of the families that are left behind when these women unfortunately die. It's a reality for us that 60% of our patients will have stage 4 disease, and this is why we are all meeting here for the patients who cannot be here with us to discuss these very important issues that concern them. And I think we've had a lot of important and great things that we've already started doing. We have done a lot of work about awareness, and I think awareness is not just for the community, it's awareness for healthcare workers like us. So if someone comes with a sign, will I recognize that this is likely to be cancer, and will I do the right thing by them by doing the right tests, which Roche may have provided in the Empower Clinic. But if I don't know that it's the right thing to do, even that resource that they offer will not be beneficial to that patient who enters the clinic. And if I make that diagnosis of cancer, will I have provided the ability for treatment to be given to this patient, whether it's in the early phase of the disease or it's in the late stages of the disease, and will I be able to provide the best care for them? So awareness is not just for the community, it's awareness for the healthcare workers, it's awareness for policymakers to know that these interventions we're talking about, will they have an impact? And one of the things that Dr. Alan Pamba said last night at dinner was that how do we, I think it was Dr. Paul from Roche, how do we know that we are succeeding? So we have to know we have to be aware of the magnitude of the problem that is facing us with regards to cancers in women, so that in 20 years we can say, all these things that we are talking about, we have been able to reduce their mortality, we've been able to reduce their morbidity, we've been able to reduce the impoverishment that comes when someone is diagnosed with cancer. So we need to be also aware of the magnitude of the problem for us to be able to measure whether what we're talking about here will be successful in the future. And I think we have big, audacious goals to reduce the cancer threat. And if we have all the policies, and one of the challenges that we have in Africa, we are very good at writing policy frameworks, but we really struggle in implementing them. And only if we implement these policies will we reduce the burden of cancer, from prevention of developing cancer and to actually saying we've improved outcomes in terms of reducing mortality. If we do not implement all these policy frameworks, then it will be 10, 20 years from now, we'll be in the same room talking about the same things. So big, audacious goals are good, but implementation of them is what is important. We have to start somewhere, and we have started here with decentralizing care in Ethiopia, in Kenya. We've heard about the cancer treatment centers that have opened across the region, but we can also do cross-country treatments. Where I work in Aga Khan University, we are privileged to have had the first PET-CT scan, which is an advanced scan technology. But what that has done is that we've seen patients coming from Nigeria, from Congo, from Burundi, from Rwanda. So we can have things in Africa that do not have to be in each country, but they can be in one country and everyone from the continent will benefit from them. So we have to think more, we have to think globally and act locally. I think that's something that we say a lot, but how do we implement that? And then we have to have equity and ethics in healthcare. A cancer patient, once they're diagnosed with cancer, they don't care whether this is a public facility or this is a private facility. They are only interested in getting better. So what we have in the private sector and what we have in the public sector is like, it's integrated. It cannot be separate. They have to be integrated in such a way that a patient will get the best possible care, whichever facility they go to. And so all the standards and guidelines we're using need to be similar across the centers. And private sector can also help public sectors where they have deficiencies. For example, when we have problems with radiotherapy in the public facility, we often get patients treated in the private facilities at affordable rates. So these partnerships are important in improving the access to care for our patients, and that is why we are here. And in closing, I just want to say that there's an urgency to this that many of us in this room may not be aware of. Every day, there are 8 women who will die from cervical cancer. And if we do not make changes now, that trend will not change. So we have to be urgent, and we have to upscale all the things we're talking about here to make a real impact. I'd like to thank all our speakers who have really outlined what the public sector and the private sector are doing to reduce the threat of cancer death in women. Thank you.
Thank you, Dr. Mwanzi. And I will just go back to our panelists on stage and online. If you would like to give a few parting shots, just last thoughts about the topic. We'll start again with Dr. Tadessa.
I would like to reiterate what Dr. Chamilish said during her keynote address. So she has remarked that women and girls are disadvantaged by discrimination rooted in the socioeconomic factor and economic factor. So women's health should be a concern, and actually it is a concern for all of us, especially for African. And we all know that women represent the cornerstone of families, the cornerstone of country. So we need to work hard to improve their health. But unfortunately, there are a lot of challenges which we are facing, and I can say there's a lot outstanding issues to be solved, to be tackled, and we all need to collaborate in addressing those challenges. So in order to improve their health, we need a holistic approach, we need a comprehensive approach, and we need to work towards the vision set in our strategies, and also in the SDG, which is improving the health. And during the third panelist, what amazed me actually doesn't amaze me, but because it's something I know, but it was striking to see that most of the countries in Africa, if you have seen the presentation, they have scored high or near to the average of near to the global average of attitude, but when it comes to action, it was very low. So I would like to say we all need to get into action. And as most of the audience here, I guess, is the private sector and the investors, I would like to say, let us invest in improving women's health, and I'm sure that we will get the utmost profit. And finally, I want to conclude by saying one famous slogan, healthy woman, healthy world. Thank you.
Thank you, Dr. Tadessa. Dr. Bomalenia, last thoughts.
I have 3 final thoughts for all of us. And the first one is that the time is really ripe for us to do something to accelerate interventions towards early detection of women's cancers. I think that has come out very strongly. Secondly is that there are a lot of opportunities that have been harnessed so far. There's a lot that has been done, and the discussions here on the panel by my fellow panelists has really resonated with me and with the work that we do, and I hope it has also given you some light. And thirdly is that we have a lot of gaps. We still have work to do. And I want to challenge us that what can we do, what can you do, since this is the Africa Health Business Symposium, as an individual, as an organization seated here in the audience, what can you do to address these women's cancers, to contribute towards that? Can we embrace opportunities for partnership and collaboration? How can we harness technology, innovation, our past successes, for example, in addressing the diseases, infectious diseases like malaria, like HIV, like COVID? How can we harness that? How can you harness that? And even together also harness our joint commitment, which has brought us here, so that we can reduce the threat of women's cancers in Africa. Thank you.
Thank you, Dr. Bomalenia. Okay, I'm going to go to Dr. Ben Abdallah. Any final thoughts?
Thank you. I would just remind ourselves here that cancer does not happen only to others. So we are African. At the end of the day, we will also receive our treatment or our management in this continent. So we need really to take actions. And here we are few people, but we are responsibility of the whole continent. And we can do something. I just want to end up by asking the question, how can we hold us all together accountable after this meeting to change the narrative so that we can take actions? It's good, we do see the commitment, but then what happens once we are back to our home country? Thank you.
Thank you. And on behalf of AHBS and my home organization, the Healthcare Federation of Liberia, thank you very much for attending this session. Good day.